Critics have long questioned procalcitonin's clinical usefulness. Its sensitivity and specificity for distinguishing bacterial infections aren't perfect, but diagnostic accuracy doesn't tell the full story. To unravel the enigma of procalcitonin, we have to look at how the trials were actually conducted. Unlike most lab tests, procalcitonin has undergone massive meta-analyses of randomized clinical trials. And these trials weren't testing diagnosis. They were designed to determine if procalcitonin could inform physicians when it's safe to withhold antibiotics, not whether the patient has an infection. The results? More than 25% fewer antibiotic days, 30% fewer adverse effects, and significantly lower patient mortality. So procalcitonin is a prognostic biomarker, not a diagnostic test. Its power is in telling us when we can stop. How can a test with modest accuracy be so powerful? Because physicians massively overtreat. The pretest probability of unnecessary prescriptions is high. It's safe to stop because the infection wasn't bacterial, it's already treated, or the host response has it under control. In all these cases, a negative procalcitonin result has a helpful clinical impact, whether it's diagnostically true or false. For many of us, procalcitonin is a psychological tool. It's an anxiolytic for the anxious physician who isn't sure if it's safe to stop therapy. But as the shorter is better movement gains ground, using procalcitonin to further reduce therapy becomes more difficult. The BALANCE trial looked at this morass of confusion, testing 7 days versus 14 days for non-staph bacteremia. They found that while high procalcitonin at day 7 predicted higher mortality, continuing antibiotics didn't help. The test stayed elevated because of underlying disease and inflammation, not because of active infection. Prolonging therapy didn't change that. The verdict is clear. Procalcitonin is not helpful to inform management when elevated. It's only helpful when it's low. Its real utility is in the day-to-day struggle in the trenches, helping us avoid unnecessary and potentially harmful therapy for our patients.